The respiratory exam is an interview and physical assessment that is performed when a patient presents with a respiratory problem or a history that is suggestive of a pathology of the lungs. You will be conducting a complete respiratory assessment on Ms. Jones because she has a history of asthma. Her asthma will be a major focus in this assessment, but you should also cover a targeted review of systems and her family history related to this system as well. Don't forget that it is important to get a full picture of Ms. Jones' asthma history, so let's start there. I am going to ask my first question, and I'm just going to ask her, when were you diagnosed with asthma?
My doctor told me when I was pretty little. I think it was about 2.5. I used to have a lot of trouble with asthma attacks back then.
What does it feel like when you're having an asthma attack?
I haven't had an asthma attack in a while, but I used to get them growing up, and my chest would feel really tight, like I couldn't take in air, and I would wheeze really bad and get all sweaty. It was way worse than now, especially because I would use my inhaler and it wouldn't help. It was really scary.
All right, so that was a lot of information, and you're going to want to dig deeper into that. Many students forget to include asking about any current symptoms such as coughing, with exertion, without exertion, asthma triggers, and chest pain, so be sure to include those as well. Also include asking about tobacco use as well as marijuana use, as both are inhaled into the lungs and can be damaging, especially for a person with asthma. So I'm going to start off and just start you off, I should say, and ask these questions. Have you ever smoked cigarettes?
No, I think it's gross.
Have you ever smoked marijuana?
Well, I used to smoke pot, but I don't do that anymore.
All right, I'm going to go ahead and let you take it on from here.